Evidence, and I think now there would be few people who disputed that what happens in children's early lives is absolutely instrumental in what happens to them later on. I'm Marion MacLeod and I'm Policy Manager at Children in Scotland. Children in Scotland is the national network agency for children's services in Scotland, and we have quite a range of work usually that we're involved in, quite a bit of which involves direct contact with children and young people and their families to enable their views to be represented in the planning and policy process. We have currently around about 430 member organisations, and that includes most of the local authorities, NHS boards, police, other relevant public bodies, voluntary sector organisations. We have people who train the children's sector workforce, so colleges, training organisations, also organisations like universities and university establishments that do research in relation to children and families. We provide supportive services for the sector, so we provide training, publications, conferences, seminars, policy development, influencing policy, and we also operate a couple of national support services. We also undertake a lot of contracted work, both work that we do on behalf of government or other agencies that contract us to do specific projects, but we also apply for grants to do projects that we think of ourselves. The history of Children in Scotland is that we started just over 30 years ago, at that time called the Scottish Child and Family Alliance, and it was a group of people within the children's sector who came together, who recognised that there was a need for such a kind of infrastructure and coordinating body. Because I met one of the staff at an event and we realised that we had a lot of common interests. I am particularly interested in services that support families and prevent problems rather than ones that intervene once a problem has happened. I'm particularly interested in how early life impacts on later health outcomes and health and other outcomes, health, educational and social outcomes. I was at an event where I made contact with Ruth Jepson. I was talking to Ruth Jepson and she suggested that I might be interested in becoming part of a working group. Probably particularly more proud of was when I was a social worker and I actually kind of could do things I could see were making a difference to people's lives. But I think influencing policy in a way that ensures that the good research that we have and the knowledge that we have is applied and used productively. And while I think we are not reached our destination, I think we are certainly, our direction of travel is much more informed by research and evidence. And I think now there would be few people who disputed that what happens in children's early lives is absolutely instrumental in what happens to them later on. Whereas I think if you went back 20 years, I don't think there was that level of acceptance, and I don't think we knew the information about things like early brain development and indeed had the longitudinal data like growing up in Scotland that showed how early life experiences really had a profound and enduring impact on many children. So, you know, it's not a particular piece of work, but I think just getting that message across by, you know, keeping it in the forefront of people's minds, I think has definitely changed people's mindset. I think we're now at a point where we need to think, well, what does that mean in terms of implementing the transferring the research into policy and transferring the policy into action? I could sum it up in terms of saying that preventing harm rather than reacting to it would be one policy that I would absolutely endorse. And what I mean by that are, first thing, that mothers are healthy both pre-conception and in the antenatal period. So services are provided that ensure that women who intend to have children are as healthy as possible and supported in being as healthy as possible before they conceive, that they are supported in keeping well during the pregnancy, because that increases the chance of the baby being born healthy. If a baby's born with low birth weight or with other problems, then clearly their chances of good health and a good life are already compromised to some extent. Second thing is about bonding and attachment. It is vitally important that children, if they are to develop, if their brain is to develop and they're to develop good emotional health and resilience, is that they have a strong attachment to a primary caregiver, and that the services, health services and other services with which families interface, know how to promote that and do everything they can to promote that. That parents are supported in carrying out their task as parents. So they are given good information and good support, and they are enabled to provide a healthy environment, an emotionally healthy environment, a good home learning environment, and a good physically healthy environment. So nutrition, exercise, play, all the things that help children learn and develop. But we also have to recognise that some parents, not every parent can provide everything to the extent that a child could benefit from. For example, if you've learning disabled parents, they will probably not expose their children to the same range of vocabulary as somebody who's a university graduate. Now, the acquisition of language is highly correlated with later educational attainment, so if the children are not exposed to the range of language, they will not acquire the vocabulary that then helps them develop the skills that then help them acquire literacy and access other kinds of learning. So, what I've said about prevention also means that we prevent children falling behind, where they are likely to do so not because their parents are abusive parents or neglectful parents, but because they just don't have the skills or knowledge themselves to enable them to give the children the richness of learning environment that they could benefit from. So we should be able to provide services that ensure that the children receive greater equity in the inputs they receive from their families. Even if the families have got a limit in their capacity to provide that themselves. Inequality. I think that it's not just disadvantage, but unequal outcomes that I think is the main thing that I think we need to tackle. We certainly need to tackle the things that generate inequality. But if we could provide things that did not mean that so many children had very unequal outcomes very early in life, then I think we would be a long way to solving quite a lot of problems. Well, realistically, I think I'd probably be retired, but I think if I wasn't working, if I was continuing to work and I wasn't working here, I would think I would be working elsewhere in the children's sector. I believe strongly that what we do with children affects everything else that happens in life. I think the most important thing is children. I think that we end up with a lot of problems that are entirely preventable because we don't do things in people's early lives that we could have done, and I think increasingly research is showing that.